It was a cold February night in 1994. Inside the bright, sterile walls of Riverside General Hospital in California, the emergency room buzzed with the usual chaos. Nurses moving swiftly, monitors beeping, voices echoing under the fluorescent lights. But no one inside that building could have imagined what was about to happen. At 8:15 p.m., paramedics rushed through the sliding doors with a woman barely conscious on a stretcher. Her name was Gloria Ramirez, a 31-year-old mother of two from Riverside. She was breathing rapidly, her heartbeat irregular, her skin slick with an oily sheen. The paramedics said she had late-stage cervical cancer, but something else was wrong. Something they couldn't explain. The ER team immediately took over. They hooked her to monitors, inserted 4 lines, and tried to stabilize her heart rate. Dr. Humberto Ochoa, the attending physician, called for a crash cart. Gloria's blood pressure was plummeting. But as nurses worked to save her, an eerie detail caught everyone's attention. A faint, fruity, metallic odor coming from her body. At first they thought it was nothing, maybe the chemotherapy drugs or a household chemical. But within minutes, things turned horrifying. Nurse Susan Kane drew blood from Gloria's arm, and as she handed the syringe to the doctor, she noticed an ammonia-like smell rising from the tube. "Do you smell that?" she asked, frowning. The doctor nodded but focused on the monitor. Gloria's heart rate was flatlining. They began CPR. Then suddenly, the nurse staggered backward. Her head spun. The room blurred. She fell to the floor, gasping for air. Another nurse, Julie Gorchinsky, ran to help her. But within seconds, she too started feeling dizzy. Her vision darkened. The metallic taste filled her mouth. She tried to speak, but the words wouldn't form. She collapsed beside the stretcher. The ER erupted in chaos. Staff screamed for help. One by one, medical workers began collapsing, fainting, vomiting, shaking violently. In just minutes, 6 people had fallen unconscious. The remaining doctors scrambled to evacuate the emergency room. But Gloria Ramirez still lay on the bed, pale, trembling, gasping for her last breaths. They couldn't leave her. Dr. Ochoa and 2 others stayed behind in protective gear, desperate to save her life. But despite every effort, CPR, defibrillation, adrenaline, Gloria Ramirez was pronounced dead at 8:50 p.m. And that was only the beginning. As her lifeless body lay in the trauma room, sealed in plastic sheets, staff outside the ER began to panic. More and more people complained of nausea and burning throats. The ER had become a biohazard zone. Police and hazmat teams were called in. The hospital was evacuated. But no one could answer the question echoing through every hallway that night. What made Gloria Ramirez toxic?